I'm Andriana Abariotes. I'm the Executive Director of the Twin Cities program of LISC, the Local Initiative Support Corporation, and really appreciate you all coming out today to be part of this conversation. And we've been a partner alongside the Fed and Wilder Foundation and Blue Cross Blue Shield for some time in these conversations. And I just feel like every time we gather, we go a little bit deeper and a little bit deeper into this intersection between health and community development. So one of the things that we really wanted to do with this final session was make sure that you did go home with some real tangible tools, some approaches, resources that you can take back to your home communities and organizations. And how this session's going to work, we have two expert folks with us, Paul Mattessich, who you met earlier in the previous session, and Brooke Finn, who's with NeighborWorks America. And in the essence of time, I'm not going to go into their bios, but their bios are in your packets. And both Paul and Brooke are going to do some presentations just to ground you in the work that they've been individually doing. We're going to have a little opportunity to kind of go into dialogue and for them to ask each other questions, and we'll have a couple of follow-up questions, and then we're going to open it back up to make sure that it's a back and forth dialogue with you all. So with that, I'm going to turn it over to Brooke, who's going to share information from the success measures work that NeighborWorks America.
So thank you. It really is a pleasure to be here today, and enjoyed the dialogue so far. And it's a heavy pressure that we're going to hand you the tangible things that you're going to take home here. So hopefully we'll come close. I represent NeighborWorks America as a national intermediary that works with community development organizations around the country. And within NeighborWorks America, we have a NeighborWorks Services group that also provides services more broadly outside of our affiliated network. And one of the services that service areas we work in is outcome measurement. And in that space, Success Measures is our premier platform for participatory outcome evaluation. And so just briefly, Success Measures really has three components. For those of you who aren't familiar with us, it really combines three different elements. One is shared measures, and that's really what we're going to spend most of this time talking about. But over the years, and with lots of practitioner participation, we have built out a set of data collection tools around many of the dimensions that relate to community development. And some of those, as you'll see, actually relate quite closely to the intersection of health and community development. We also have a technology platform that allows people to use those tools online and manage their evaluations online. And we provide services to help organizations or their funders in framing evaluations and actually conducting them. So the project that we thought was most relevant to today was really a large shared measurement project that Success Measures conducted with NeighborWorks America as the client organization, if you will. And a shared measurement project really means that you're trying to get multiple disparate parties to use the same framework and the same measurement tools and the same methodology to look at a common defined outcome. That sounds so easy, but really not. And in the NeighborWorks context, there were over 200 very diverse organizations around the country who were participating in this project. And for them, it was a shift from being able to locally define how they were going to talk about the change they were making in communities to coming together around a common way of defining that, measuring that, and talking about that. So that's really the challenge of the shared measurement project that we had. Fortunately, we had a number of organizations who had dabbled with success measures and had already started to identify areas that they thought were relevant to the outcomes of their work in communities. And so we had something to build on. So this was not sort of imposed from on high, and it really did have a grounding in what organizations were doing. Nonetheless, it was a gradual process to get people to buy into a common framework. I would say if you hear one thing from me today, it's The shared measures are really powerful, but it takes time to get people to the place that they're invested in them. So don't take it on lightly. Just to give you a feel for what we're talking about in terms of the shared measures, in this particular project, the dimensions that we landed on were really physical conditions, and each organization picked a sample area. So we have organizations that work countywide, statewide, very neighborhood-based. And in this case, they picked an area that was between 500 and 1,200 households. So it was a reasonably sized area, but not huge. And they used a set of observational rating tools, both for the conditions on blocks and for conditions of properties in there, on those blocks, and kind of an objective rating scale. The more difficult data collection part of this really was to get at the resident experience and perception. And this was really done through a resident survey, most of which was done door to door, so that's fairly labor intensive. But it really delved into some of the things that we've heard people talk about today as really key to community well-being and health, including how satisfied are people with the quality of life in their community? Would they recommend it as a good place to live? Do they feel that they have the ability to make positive change in their community? Are they connected to their neighbors? Are they engaged in efforts to improve their community? How do they perceive safety for themselves, for their children? How well do they know their neighbors? How likely do they think their neighbors would be to help them out in a situation if they needed help? So it really was a survey that delved into those dimensions of experience of residents in community. And then the third dimension of the framework really was to bring in some of the secondary data around conditions in the neighborhood. And we also use Policy Map, which you've heard spoken about earlier today, which is a great resource. And we did one additional thing, which was because we already have a lot of data from organizations on the housing work they're doing, using an economic multiplier to really say, what's the economic impact of the housing work that they're doing in those places. So that's the framework. I wanted to try to be as honest and real as I could be about what it takes to do a shared measurement project with that many moving parts. And I would say you'll hear the word support a bunch of times here. In this case, support for data collection really meant a lot of training of people because local organizations were doing the data collection in their communities. And in many cases, that support happened through, a lot of it was remote webinars, recorded sessions, resource material. We assigned individual coaches to work with each organization. It was a fairly light touch, but still they had support to actually implement the project. Many of them, as you might imagine, doing that kind of resident survey really engaged folks from the community to help with the survey effort. And you'll see in the back end that actually proved to be a real strength of the project. We also gave some small incentive grants just to defray some of the costs, but nowhere near probably what they felt was the pain inflicted in doing this project. And lots of templates, examples, and peer sharing. One of the things when you're working with a group this diverse is you always have some folks who are kind of out in front, pioneers who come up with a great idea that you can share with everybody, and that really was a powerful motivator for other folks in the project. We also provided a lot of support around analysis, and I'm going to say here that one of the keys that I think made this project feasible at all was constructed in a way that each local participating organization could get something for themselves in addition to contributing to a collective view. And so, if again, sounds obvious, but sometimes in shared measurement, we don't think of that at the front end. We realize that on the back end. But really important that the participating organizations, whether it's different organizations in one local community or it's organizations all around the country doing a similar thing, it's really important that they get something out of it directly for themselves in addition to contributing to a collective story. So in this case, on the analysis, we started first helping organizations analyze their own data locally and how could they use it and what did it tell them before we started saying what's the macro picture coming out of this work. So that for us was important. What you're seeing on the screen is an example of a really low-cost GIS solution where they could just map some of the data points from the block and property observations to sort of be able to say, are there pockets where we have real problems of housing conditions? Are there blocks that are really great and blocks that are really terrible? And how might we align our strategies with that? We provided a lot of assistance really to help organizations figure out how they want to package and use the data locally. This is from a PowerPoint that one of the organizations did that really just takes some of the data and talks about, this is how people feel about the community that we're working in. They shared that with boards, with residents, also with local governments and those kinds of things. So really helping people kind of not just collect the data, but use the data, I would say, was fairly key. So what was the value in this? I would say that using the shared measurement approach really forced a lot of dialogue around the why of what we do. And sometimes it's easy for measurement to get out in front of that, but I think if you give yourself the time to have that conversation, it regrounds people in the why of what they're doing. As I said, the data collection was a laborious effort. We actually got a fair amount of resistance about doing it. I think on the back end, what we learned is that most participating organizations found it really connected with them with their community. It really helped people from their organization also be more aware of the conditions in the community where they were working. We had board members and staff who said, geez, it's been a long time since we walked this community that we're allegedly working in. So there were really a lot of sort of benefits in the process that actually were not necessarily the drivers of doing the project, but actually were really important benefits. But I would say, across the board, and something that we found really encouraging, this was all the ways that people could put the data to use right away. And now this was designed as a two-point-in-time kind of comparison study. So we've only done the first data collection. So we don't really have the ability to compare on any of those dimensions. We looked at, has the needle moved in a positive or negative direction in any of those areas. But we were really thrilled to see the number of ways that folks are using the data already. So one is the immediate feedback loop to organizations about their programs and strategies. So for example, a number of the organizations who participated do a lot of first-time homebuyer education, helping folks get into homeownership in a particular geographic area. And they always assumed that renters who lived in the neighborhoods wanted to move out. And what they found when they did the survey is that renters in the neighborhood actually really want to buy a house in the neighborhood. And so they changed their strategy. So that was an example. Again, engaging with residents, because there were a lot of, the survey included questions about how did people feel about their ability to work for positive change, and would they be willing to work together to improve things in the community. They found a lot of people who were really underutilized as resources in the community, and so they were able to connect with those folks and say, really, we'd like you to serve on this committee, we'd like you to participate in this event, would you like to engage in a way? So it really had some payoffs in terms of resident engagement. It also really helped organizations dispel myths and tell the story of places that they're working in new ways. Probably the most extreme example, total serendipity, but an organization in Vermont did this project in a particular neighborhood that was profiled in the New York Times in a very unsavory way shortly thereafter. And they were able to immediately turn to their resident survey data and say, no, actually, people who live in this neighborhood feel that it's a great place to live, would recommend it to people as a good place to move, feel their children are safe in the neighborhood. So they were able to use this data really to counteract a negative perception of a place by an external party. So that's just one example, a kind of extreme, but but it really, in almost every case, allowed people to acknowledge that there were real positives in places, and there was real connectedness among residents and real assets to build on in terms of moving the communities forward. They also really found in doing this, they connected with allies and partners. A lot of local governments were really thrilled with this project and the information it generated. And some were able to leverage resources to forward their work. So those were all important values for participants. A few of the key lessons. This is, again, obvious but often overlooked. Be attentive to the value proposition for the participating organizations. Shared measurement that is really of value to whoever the aggregator is really difficult to implement on the ground, but thinking of the ways, how can a local organization use this, what are they going to get out of it is really important. Building from existing practice as opposed to thinking of it as just an add-on. For us, it was really important to be able to say, well, this isn't a net addition of time and energy because people were already doing this in their own individual ways. It was more, this gives you a more powerful story to tell on the back end because you're doing it collectively and you can talk about it in the aggregate. As I said earlier, don't shortchange the upfront engagement and mission alignment conversation. Shared measures really, as we just experienced over lunch, shared measures really have to have people chew on them for a little while, engage with them, feel that they really can own them and they understand that what they think is important in outcomes is represented in the measures. Focus on local use as well as the collective use. And the last thing I would add is, particularly when something is new in the measurement sphere, fear is usually an element of the conversation. People are afraid how data is going to be used, particularly if there's a power dynamic or a funding dynamic and somebody thinks their money is going to be jeopardized because of the results. So I think starting these projects with a learning agenda is really important, and being explicit about that is really helpful to keep people from assuming that this is going to be used against them in some way. So.
And as we switch over to Paul's presentation, I know folks are going to be having a couple of questions. One immediate question popped into my mind is, success measures is a fairly participatory process. How did the organization staff some of that resident engagement, or how did they pay for it? Was that something that was supported by NeighborWorks, or did that come out of their own organizational budgets?
Both and. First of all, most organizations, because they are community-based, already have some activity going on in the local level, some level of resident engagement around activities and some volunteer activities. We give them a small kind of stipend to offset some of the costs. A lot of them used youth volunteers or university volunteers or other local community groups that helped with some of the data collection.
Great. Well, hopefully folks will be thinking of some more questions for Brooke, but I'm going to ask Paul to talk a little bit more about his presentation that's going to go a little bit deeper into collaboration, because I know a lot of the work that is happening with organizations across the room is also not just from an organizational or neighborhood perspective, but also from a collaborative one. So, Paul.
Thanks. Yes, I'm going to do three things quickly. As Andriana indicated, is to talk a bit about collaboration and measuring that. And then secondly, I want to give you just a high-level overview of some of what we discovered while the research in the Federal Reserve Bank of Minneapolis in some national research we've done related to outcomes measurement in cross-sector collaborative initiatives, and then just take a minute to tell you what we're developing right now based on that research. So Andriana asked to take this very different kind of slant for a few minutes. It's not the kinds of metrics we've talked about today so far, but it really is addressing the issue of what if you want to measure the effectiveness of your collaborative process itself, or kind of diagnose whether it's going as it should or whether you should strengthen it in some way. And when we talk about collaboration in cross-sector initiatives, we're talking about some form of relationship that at least two or more organizations enter into. It has some goals, it has a structure, it has shared responsibility, authority, accountability. There's some sharing of rewards. And we asked the question a number of years ago, what is it that produces a successful collaboration? Is there any way that research could identify ingredients that, if you had them, would increase the likelihood of collaborative success? For example, in a cross-sector initiative between community development and public health organizations. So what we did was to take all the research existing at that time, put it into a meta-analysis, and out of the studies that we were able to meta-analyze, identify some factors. And we had some extensive ways of deciding whether evidence was valid or not. And if you look at the original publication, you can see that. And that original publication is a book that is called Collaboration, What Makes It Work. But we did the analysis. We looked at all the research that was examining what produced successful collaboration so that we would have an evidence-based result. And what it did was to point to 20 factors that were important. And I haven't listed them all here now, but they were things, for example, like a history of collaboration or cooperation in the community, mutual respect, understanding, and trust, an appropriate cross-section of members, open and frequent communication. And if you look at, it's not a handout, but if you look at the instrument online, you can see the 20, and you can also see the way that they are measured. But it was 20 evidence-based factors that if you have them in a collaboration, you're more likely to be successful. The collaboration factors inventory offers a tool for measuring the extent to which these factors are present or absent in your collaboration. So it obtains information from participants in an instrument that has some structured ratings. It can be done on paper or online. There's an opportunity for comments. It calculates a score for every one of those 20 factors. And you can get a report that assists in identifying strengths and weaknesses. We were fortunate that the RAND Corporation wanted to use this about 10 years ago because they wouldn't use it unless it had adequate psychometric properties, so they assessed its validity and reliability. And in addition, there's been a number of other studies, research dissertations, and so on, that have also established its statistical properties. If you're interested in it, I encourage you to go to the Wilder Research website and look for the collaboration factors inventory. What I'm going to do is to just really quickly show you an example of how it's used, and this will be quite quick, but I think still illustrative. And this was something a number of years back where a collaborative initiative was running into some trouble, and they asked if they could use the inventory and get our help in thinking about it. It was a collaborative to improve access to health care for low-income residents of a region. And it was formulated, this initiative was formulated because there were two major perceived needs, that the current system wasn't being responsive to changing demographics in this community, and therefore the county health department staff promoted forming some kind of a collaborative. That included a nonprofit health care center, a county public health department, a neighborhood residents association, and a nonprofit immigrant social services organization. They use this inventory, and I know this looks like a lot of data in front of you, but for every one of the factors that were measured through the instrument, they could get a score. So you see the first one on there, collaborative group seen as a legitimate leader in the community, and you see the very first number, 4.4, that all of the people who were participating in the rating, on average, gave it a 4.4 rating, which is a relatively high rating. It's a good rating. You can also see the rating is broken out by the different groups who are participating. And you can see that for a variety of these factors. You go down to the next one that's circled. Members see collaboration in their self-interest, relatively high ratings, 4.5, 4.8. Members share a stake in process and outcome, relatively high ratings. However, there were also some places where using this inventory started to direct them towards what their problems were. So they got very low ratings on the factor established informal relationships and communication links. Almost everybody thought that that was something that wasn't at the level where they would like to see it. As well, some mixed ratings on mutual respect, understanding, and trust. Especially you see the 2.7 at the far right from the immigrant services group. So they started to understand what some of the issues might be. And what was interesting and that you can see you're able to do with this instrument, is to identify differences between different types of organizations. So in the case of appropriate cross-section of members, the neighborhood organization and the immigrant services group gave it a relatively high rating. The other two groups, the formal care organizations, it was high, but not quite as high. And that's something you might expect, because sometimes those informal groups are not enfranchised to be part of the process. One of the interesting, just one more illustration from this, but one of the interesting findings in this particular study came with respect to a factor that's called unique purpose. And it's clear from the research evidence that for a collaboration to be strong, the purpose of the collaboration has to overlap at least some with the purposes of all the participating organizations. However, if it overlaps too much with any one, they get threatened. What was interesting in this particular case was that the public health department gave it the lowest score on unique purpose. And that's interesting because they actually suggested that this occurred back when some of the initial community controversy and so on was arising. But once this group started to become more prominent and take over, their authority was somewhat threatened, I think, and therefore they gave that lower score on unique purpose. Well, that's just a really quick illustration of how you can use this. I'd encourage you to go to our website. It's online at Wilder Research. You can use it as much as you want. It's totally free, totally confidential. We won't know you're using it. National Security Agency will know, but we won't know. And you can do it, as I said, online. You can do a paper version. There's ways you can get multiple people to do it online and so on. Switch back from collaboration to the sorts of metrics we've been discussing today related to community impact. Ela Rausch and I have been involved in a national study that's had a couple of iterations, data collection phases. It was a partnership between the Federal Reserve of Minneapolis and Wilder Research, and it was a response to the Robert Wood Johnson Commission's call for establishing measures that would spur more collaborative approaches to building healthy communities. As part of this project, the study or the survey that we did tried to determine things like the social determinants of health that organizations around the country address and how that has influenced their work. It asked participants how they have been working collaboratively across sectors to promote community health. It asked them about how they've been measuring health impacts, and it asked them for advice that they would have for other organizations who would like to do similar work. In that study, we had a national sample of 613 respondents from 46 states, and what it showed was quite widespread examples of cross-sector collaborative activity. It showed that there are public health and community development organizations working virtually around the country on direct service initiatives, policy initiatives, infrastructure initiatives, and other combinations, permutations of work to promote community health. We asked them specifically to identify how they measure that. And as Amy Gilman said earlier, we found that a lot of them do like to measure outputs. And the kinds of output measures they were using, and this just represents the Community Development Finance Institution bank segment of the sample, includes things like you see on the screen. So with respect to early child care, education, things like the number of programs, the number of child care slots, the number of student seats. If you go to the middle, you see economic well-being examples, number of participants who open an account, number of jobs created. They're down at the bottom, number of bikes, number of pedestrians, number of crosswalks. Go to the right-hand side, number of affordable housing units, number of program participants who purchase an affordable home, number of community gardens, number of nutrition classes. all very legitimate outputs, all measures of the volume of activity which are very feasible to implement. We also asked about outcome measures. And here you can see things like, on the upper left-hand side, high school graduation rates, proficiency test scores, types of things that Frank was mentioning, especially during his earlier presentation today. You can see outcomes related to economic well-being and economic conditions. Some of them would be initial or intermediate outcomes, like increased savings, increased access to credit. You can see in the right-hand column, under neighborhood conditions, many of the kinds of things that Brooke was talking about, measuring social connections, neighborhood employment, changes in income. What we discovered was that there was a lot of good measurement going on. We also discovered that there is a long way to go. In many cases, when we asked, for example, what outcomes are you measuring, what we actually got were these kinds of things. The number of places we built, the number of people that we served, but not necessarily anything that was resulting from that. So we saw, although we saw some very valid measurements of outputs, and although we saw some very valid measures of outcomes, we also saw that in many cases people were confusing those, and they were using these volume of output measures as their outcomes, as opposed to actual changes in behaviors or environmental conditions or other elements of the environment that you want to influence through these collaborative cross-sector initiatives. We also saw how precisely the types of issues that are being addressed by the collaboration between Robert Wood Johnson and the Federal Reserve nationally are important in order to move the field ahead. These sectors, while they collaborate and while they communicate to some extent, don't do so adequately in all cases, and that's where more work needs to occur. So to address that, we're actually working on a project, first results of which should come out in mid-December, where we are taking the next steps to identify the most common outputs in use, what they are, what the data sources are that are reliable and valid. We're identifying the most common outcomes, what they are, what the data sources are that are most relevant. We'd like to relate them to the work you saw earlier of Dr. Plow and the kind of ultimate outcomes that his model is addressing. And we're going to develop some resources in the form of sample logic models for common cross-sector initiatives, what inputs, activities, outputs, and outcomes might look like if you were engaged in an initiative to achieve a certain outcome, so that practitioners have a better idea of what they might be measuring. And we're going to write up a number of case studies that came up from the national work to show how these collaborative initiatives have used metrics, what their process was for developing those metrics, to give more insight into that, and how they've overcome some obstacles. Parting words of wisdom from some of the participants in the survey. Impact measurement is difficult, time-consuming, and expensive. However, the knowledge gained and the ability to translate outcomes to stakeholders and investors is invaluable. Access to funding is improved by key impact data that not only reflects outputs, but also outcomes that result. And that came from a finance institution. Biggest piece of advice would be that it's okay to start small with just a few metrics. Sometimes organizations start too big and become overwhelmed. It's important to build outcome measurement in at the outset of the program, setting expectations and identifying key metrics in advance. So, quick coverage of those three topics, the collaboration, the work that we did, the national research that we finished up, and some of which is reflected in the article that you received in the packet, and then what we hope to produce as useful tools for the future.
Thank you, Paul. So We've heard quite a bit of information. We heard about a participatory process and the success measures that NeighborWorks undertook for the organizations in their network, both at an individual and a collective level. We heard a little bit more about how to measure collaboration and found a very useful tool that we can all go back to and use today. So thank you, Paul, for that and Wilder Research. And then we're seeing kind of the precursors of what's to come in some of the gathering that many of you may have already contributed to in the metrics survey that came out earlier this spring, wasn't it? Or yeah. So you'll have to be back next year to also get to the conclusions, or maybe sooner than that. Hopefully we'll see that sooner than that. And all of this information is going to be up on the website for the conference. Is that correct, Ela? So we wanted to just take the last little bit of time here to open up the questions. And maybe what I'll do as you all are thinking about it is, you use the word overwhelm, Paul. And maybe there is a little bit of a sense of overwhelm that folks might have about their own organizations and or in their own communities of where to start or how to start or what. Can you both give a couple of examples of how partners that you've worked with kind of navigate what could be a very broad set of measures, and how do they make those decisions?
Sure. So we work with a wide range of different organizations around evaluating different kinds of things. I would say the common denominator is start with something like a logic model if you don't have a full-blown one, so do logic model light, but you have to understand sort of what it is you think you're trying to accomplish. And then kind of overlay that with, the filter of what do we already have some information about, and sort of, the red on the heat map is where's the real gap in our ability to talk about an outcome here. And so in the case of, community change, it really is, okay, we really have to get that resident piece. We can get the median home prices and we can get the crime statistics, but we really can't get that. So really, I think starting with that, starting small is right, and I think starting with if services are offered in a big footprint, start with a place and build out as opposed to trying to do everything up front.
I'd reaffirm starting with the logic model, starting simple. I think those are the most important things. Another dimension I would add, and it was evident from the conversation today, is that sometimes these seem overwhelming because as two different sectors, we still don't have a common shared vocabulary and understanding of one another. I came out of the human services public health field. When I first heard finance people talking, I thought, oh, I'm going to have to go back to graduate school or something. I just don't understand this. Now, at least, I understand the basics. I still don't understand the sophisticated, but I understand enough that I can correspond. Today, you heard and during the earlier panel, you heard some of the finance people talk about things that public health, epidemiologists, others would say, oh, that's simple, you can get that right away. But they don't know that because they haven't been in that field. So there's still more need to kind of cross-pollinate.
Right. And so we want to open it up, but there was also another question I wanted to ask before we go there. And one of the questions, and Brooke had the ability to hear this question over the lunch hour, Paul, so I apologize.
So you go first.
But this conversation around the zip code is more important than your genetic code and the social determinants of health that we've all become now very familiar with. From a neighborhood and community perspective, could be both a powerful opener to really digging into, well, what does that mean? The issues of social ties and social equity and some of the things that we talked about over the noon hour. But there's also possibly a negative or a converse side to thinking about zip codes as some sort of predeterminer of fates. And Brooke, what I was struck in your presentation of talking a lot about perception and resident satisfaction, what implications or impact of the conversation around zip code and social determinants of health do you think either impacts what you're trying to do and the measures from a community development perspective, or as what we're doing could maybe help guide how communities navigate through that very question, or some impressions about that?
Thanks. So I do think it's important that the zip code reference doesn't end up disempowering people in communities. I think that's a really key point. So I think unpacking it into what the dimensions are, and one of the things I think that we discovered is a lot of surprise about how positive people really do feel about their communities because they feel they're connected, because they feel that they have an ability to make positive change. And so not overlooking the positive elements, even of a distressed community, is really important. And I think not sticking at the general level of, your zip code is going to determine your health, but really within that there are some dimensions in which your community could be really stronger than somebody else's community. So I don't know if that answers it. But.
Paul, any thoughts about?
Well, I think we use the word determine, of course, when we talk in that phrase. It's associated with, it's correlated with. It doesn't mean that there's absolutely no way to turn things around. Any piece of information can be misused and misinterpreted. So when we come out with this type of information about zip codes, census tracts, and how they're associated with health, we have to have a strategy that's responsible for moving ahead. But I think that we can formulate work on changing the environment, same way we formulated work, for example, in combating secondhand smoke. I mean, there were pollutants in the atmosphere from secondhand smoke that were causing health conditions. Through policy changes, we've eliminated smoking in public places. What we need to do in looking at the zip code issue is, well, what are the issues there, the irritants that are causing health indicators to be lower than we want, and how do we address them? How do we move them in the right direction? I mean, that's just the fact of what we're confronting, and that's what we have to do.
So I'd like to turn it out to the audience and questions or comments for our panelists.
My name is Erin, and I am a resident of Rochester, a recent transplant there. And I also work for the Preservation Alliance of Minnesota, which kind of brings me here today. But I'm surprised this hasn't come up yet, but we have this major health institution that's developing in a large scale with the Destination Medical Center, so the Mayo development. And I've tried to, as much as possible, become involved in this process. And what we're seeing is that the community development focus is absent. And these community measurements and engagement processes as part of the planning, again, hard to find how to become involved in that. And I'm wondering, in a room here with people in the healthcare industry, if there is any advice for how to maybe inspire more use of these strategies or measurements or processes of participation, or if this has been a discussion in other fields. So I guess I'll just put that out there and see if anyone can provide some advice or insight. I'll say, so we're looking at also. No, but so quality of life issues, affordable housing, transportation, how surrounding communities are going to be impacted, the natural environment, built environment. So we're just kind of at a loss as how to organize as citizens and professionals and partners in this process. So thanks.
Yeah, I'm not an expert in it, and hopefully somebody in the room is. To me, the fact that it's a health institution is kind of makes it particularly painful, but the mechanisms aren't necessarily any different than they would be if it was any other kind of development. In terms of, there has to be planning and zoning. There has to be the local government has to have some role. That would be the normal kinds of levers that a community would have to influence how development happens in their community. But I don't know Rochester, so I can't speak to that.
It's unique.
Yeah, I know others, especially others that do engagement here, we're going to echo this, is that in the event that you're really trying to work with an industry that you're not familiar with, it's, understand their language, create partnerships with individuals within that healthcare system, and then, do the same in the other sectors as well. But in particular, the healthcare system is just so, and we've talked about this earlier in terms of the money that's available and how that can kind of drive how the mindset around how they use it. But they are very challenged by being able to achieve these triple aim goals. And so as you develop those relationships, really tie back your partnership in helping them attain their triple aim goals or save money or whatever goals that they have, and they have some pretty lofty goals. I do know the Mayo does as well, that they'll be held accountable to. So it's just looking at not just the notion that we want to partner with you because we think it's going to be better, but really, honing in on how it can help them be more effective, and then how the housing and how all these different sectors, when they come together, how then it elevates overall living conditions, how then it increases their workforce. There's these thought patterns that they might not have gone through that will help them further, will help you further legitimize your role as an asset in their process. Okay.
Getting back to the shared measures that you were just talking about, especially when health-related organizations and health improvement efforts are trying to partner with community development efforts, finding shared measures that are helpful to all of the partners is one thing. Finding shared measures that are available, first of all, either whether you're going to gather them yourself or they're available in the census or something like that, is one thing. But it's another thing to know if those shared measures are actually indicative of change related to the work that you're trying to do. So in other words, is it an indicator of your effort succeeding or not succeeding when that number moves, when that needle moves? I wonder if you could talk a little bit about how to choose when you're limiting yourself to only a few shared measures, which is really advised, especially in collective impact models, if you're using that model. If you're limiting yourself to just a few shared measures, what can you tell us about making sure that those measures are truly indicators of what you're trying to accomplish?
So it's a question of kind of evidence-based or kind of the...
I'm happy to say a few things. Yeah. And I actually teach a course on this at the University of Minnesota if you want to sign up next fall. But, I mean, very simply speaking, the true way to know whether you're making a change is to have some kind of a valid comparison. And the stronger you can compare, whether it's before and after, or whether which is comparison, maybe the weakest, or if you can move up a level and you can say, well, we were working within this kind of a neighborhood. Here's a neighborhood very comparable. We didn't see the same change. Pretty good evidence that it was because of what you did. There's also, if you remember some of those indicators that Brooke listed, some of the outputs and outcomes that I listed, there's a number of things there that, at least in terms of the initial outcomes, you can be sure it was because of you. If people were just not going to the doctor because there was no accessibility, or they didn't get certain food because they just couldn't travel far enough, and you put a facility down and now they're going to it, well, there's really no other reasonable explanation other than the fact that you did something that resulted in that initial change. Farther out you go in the chain, to say you go all the way out to increasing their life expectancy, then maybe that's a little more difficult. But there's a number of things. If you kind of take Brooke's advice from before, start simple. There's a number of things, if you start simple, that you can point to pretty easily as resulting from what you implemented.
And the only thing I would add to that is sometimes you can connect your scenario to something that has been researched in a more robust way and sort of say, it has been proven in other situations that X leads to Y, and in our case, we're able to show that we've done that we've done Y. So, you can connect to a more robust research or evaluation that's been done in another setting.
Well, and Brooke, would you say that part of the process around driving toward that logic model and the consideration of what gets chosen to get measured is the opportunity to surface that kind of other research? Absolutely. Or just kind of the basic knowledge.
Don't waste your time proving things that have already been proven.
Or engaging with
Yeah.
with residents in another way of knowing. And so I think that the process that you said about early up front should not be jumped over to get quickly to, well, we got to measure something, or we've got a small window of time, and so let's just start and pick anything. Maybe there's a way of having a deeper dialogue in that process.
Absolutely.
Still, at any point in time, you're only going to be able to do as well as the best evidence that you can gather or the best evidence that you can muster from other places. And even when you can find research from other places, it's very often the case in our changing urban environments that, well, the research wasn't done on the kind of population we're serving, so then you're a little less sure about it, but still you have to go with the best that you have.
So Michael, there's, Jen?
Yeah. So both of you talked about sort of the work involved in measuring impact, and alluded to some of the benefits from it. But I wonder if you could talk more about what those benefits are. So getting collective measures, it's a lot of work to get there. What are the benefits of having those collective measures? Like, what are some examples of those benefits? And then in the shift from outputs to outcomes, you know, what are the benefits of having those outcome measures? Like, what does that enable in either case, people to do differently or think differently, or what different happens as a result of that?
Well, a little bit to the upfront benefits of sort of getting to the shared measures. I think probably most of what the collaboration inventory would measure would come about as the result of wrestling with that. So you're basically forging the relationships of a strong collaboration through the dialogue around what are we really trying to accomplish here, and how would we know if we accomplished it, which is how you get the shared measures. So I actually think you're doing the work of building a collaboration. The particular focus point is how are we going to measure our results. So to me, that's work you would need to do in a collaborative effort anyhow. You're just also getting the shared measures out of it. Does that make sense?
And yes, and then continuous improvement. So understanding how well you do, and not just as one number, but how well do you do in different circumstances? And you're more successful in one neighborhood than another. Why is that? What do you need to do with that different neighborhood, that different population, that different mix of characteristics, so that your success can be equal wherever you're trying to carry out your initiative?
And I think the other benefit on the back end that I would say is if you have people all talking about results in the same language, it's a louder voice. And if we're really trying to create an awareness around the need for these cross-sectoral collaborations to really change the health in our communities, having everybody talk about it in the same way is significantly more powerful than having me tell it my way and you tell it your way, and people go, huh, that's not the same thing.
One of the factors that America's health rankings use to assess relative rankings of the states is state funding for public health. And although Minnesota always scores pretty high on the overall health rankings, we score very low on state funding for public health. I think we were 46th in the last ranking. So we obviously have a system that's very effective in a lot of ways despite that lack of funding. And I think that these conversations between healthcare and community development and funders are extremely important to maybe fill in some of those gaps or see how funding can be leveraged to greater success. So kudos to the Federal Reserve and Wilder and the other players to bring these gatherings together. I'm wondering what you think, what suggestions you might have for what we can do to carry on these conversations in between these annual meetings.
I'm stumped.
Your question is how to carry on the conversations, or did you want to comment on the earlier point about the funding for public health?
Whatever strikes your fancy.
Well, I do want to comment, as our speaker, David, at the session mentioned, there's not necessarily a correlation between spending and health outcomes. I travel a lot to the UK to do work. They spend less there per person. Life expectancy is better there. Other outcomes are better there. So we need to pay attention here in this country to the fact that we're not getting the right leverage between our dollars and our health outcomes. Between these meetings, to answer that question, we particularly, at least those of us who have co-hosted this, don't have any formal activities, but we get involved in a variety of different ways in trying to bring this message out and to incorporate it into the work that we're doing. One example is, for example, just to mention water research in the Federal Reserve, that article that you saw and the research we're doing with Robert Wood Johnson Foundation.
So Mary Keefe, you've got last question.
Okay, I just wanted to comment, and I'd be interested in your comment back, I guess, is I appreciated the Wilder partnership.
Collaboration factors inventory?
Yeah, the tool that you've developed. I think there's a lot of, people are talking talk all the time about engagement, community engagement, and they also talk a lot about partnership and about the critical role of all of that. But there's few tools, even few reflective processes to think about how to figure out if you have the right people in the room, if you have the right process, or to document a process that actually happened when it worked. And so I just think that kind of thinking is really critical, and it obviously started to raise some differences among the entities involved, and I just wanted to make that comment.
Well, thanks. And I do hope, I'd encourage you all to go to the website. It's free. Try it out. See if you might use it in your applications.